Good afternoon. My name is Mary Turner, and I'm the president of Minnesota Nurses Association, which is an affiliate of the National Nurses United. That's the largest union and professional association of registered nurses in the country. I proudly work as an ICU nurse on the night shift in a COVID unit at North Memorial in Robbinsdale, Minnesota, and I have been since the end of February. Thank you, Mr. President-elect, for inviting us to take part in this roundtable. National Nurses United has been proud to work closely with you, and we so deeply appreciate your commitment to addressing this pandemic and fighting to protect nurses and other frontline workers. Right now, COVID-19 infections are surging across Minnesota and the country. Our hospitals, I tell you, are overflowing with COVID patients, and we aren't prepared. We don't have the necessary resources to keep patients and our workers safe. Nurses, I'm telling you, are feeling extremely anxious right now. We know the right way to battle this virus, but our employers and our government are not supporting us. We're trying to care for patients despite limited supplies, limited staff, and a rapid decline in the hospital beds. And all the while, we know that we could become infected and our families could be infected at any time. The physical impacts of this virus have been devastating. I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of coworkers as they fight for their lives on a ventilator, and knowing that they got sick because of the hospital or their government hasn't protected them. Throughout this pandemic, we've had to reuse N95s so many times. Sometimes the masks literally fall off our faces. In my hospital, we're still reusing N95s 2 times. But I know hospitals that they're still using them 8 to 10 times a shift, 8 to 10 shifts. We can't stay safe when we are using these kind of standards. As a result, nurses are getting sick. A month ago in my hospital, 9 ICU nurses were out with COVID. Just recently, we had 12 emergency room nurses out with COVID. We need to protect our frontline workers so that we can take care of you. Remember, there is no second line of defense. It's us. As president of the Minnesota Nurses Association, I have been on multiple picket lines with frontline healthcare workers who are protesting to get the PPE that they need and other protections. President-elect Biden, there is something seriously wrong when nurses have to take to the streets to beg for protection in the middle of a pandemic. What we're experiencing in Minnesota is what nurses are experiencing all over the country. We're not being given the protection that we need. We need to have optimal PPE for all staff to prevent airborne and droplet transmissions. We need testing of our workers and patients and contact tracing and notification of exposure for healthcare workers. Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No. We also need safe staffing of nurses in the hospital units. And patients who are or may be COVID positive patients must be isolated from the general patient population. Workers who have been exposed or who are sick need to be allowed to quarantine at home without fear of losing income in their jobs. This is a novel virus, but the principles of infection control are not. Our hospitals have not been providing these basic protections. This is why it is so critical for the federal, state, and local governments to step in to ensure that nurses are protected. Unfortunately, the federal government has not been there. As a result, the pandemic is surging and frontline workers are getting sick and dying. Nurses across the country were so relieved and grateful, Mr. President-elect, when you committed to taking action that we need to have to get this pandemic under control. Thank you for committing to invoke the Defense Production Act, to increase manufacturing and distribution of PPE, which we need to establish, and also for establishing an OSHA emergency temporary standard on infectious diseases, which could enforce protections we need from our employers. Thank you for that. We are also grateful that you have committed to a robust and comprehensive pandemic stimulus plan to make sure that our patients have the economic support they need. You know, we nurses, we know that we are facing immense death and suffering in the coming weeks, and we will be there. But we need to act now. We need to act quickly to protect our healthcare workers so that we can save as many lives as possible. Thank you.
Mary,
I'm sorry, I'm so emotional.
No.
It's just...
You got me emotional. Look, you know, anyone who spent significant time in ICU like I did for months, you know what I used to do? After I got out, I observed, this is not COVID, but I observed the incredible mental strain on nurses in ICU units. And you know what I did for a long time after I got out? I used to drive back and forth to Wilmington, Delaware. I commuted every day. And, but as vice president, what I would do, I would also, I would go out, back out to Walter Reed on the night shift and bring dinner and food for the nurses and hang out with them. For
the night shift? Cool.
The night shift.
That's cool.
And well, you know, one of the things that one of my neurosurgeons said to me was, you only see people walk out of the ICU, either they're walking out and they don't ever want to come back because they don't want the memory, or they're carried out and they can't come back. And the psychic remuneration for you guys is missing. You don't see the people you save come back. And
right.
So I'm sorry for me to get personal about it, but there's a lot that I want to talk with you about. And but I excuse, as we used to say in the Senate, excuse the point of personal privilege here. But thank you for what you do, and all your colleagues, male and female, who are manning those rooms. And now I know we got Patricia's next.